I think my greatest impact has been to provide nurses that are intelligent, skilled, knowledgeable, and provide high-quality care. I had worked a summer job at UAB Hospital when I was in high school, and I worked in a physical therapy department. So I knew I wanted to do something in healthcare because I really loved that. But I thought I wanted to be a physical therapist or an occupational therapist, and that was my pre-course study that my focus was. And then as I was in those classes, I was in there with a lot of other nursing students, and just decided, well, maybe nursing would be a better focus for me. And so I decided to change my major and went into nursing, and luckily it was a really good fit and it worked for me. When I graduated, my first job was working in the CICU, which is the cardiovascular intensive care unit at UAB. I thought it was strictly an adult unit, but when I got into the unit, I realized that they had children also in the unit. And initially, I was not interested in pediatrics at all. But as I worked there, I found that I really loved the pediatric and the adult population. There were nurses going back to school, and I thought, well, I think I would like to do an advanced degree also. So I started going part-time back to school and obtained my master's degree. And I was very fortunate. The clinical nurse specialist who was working in CICU at the time decided to re-enlist in the Navy. And so her position was available, and they offered me that position as the clinical specialist for the unit that I had been a staff nurse in. That really catapulted my career. So I realized that there were a lot of nurses who were very knowledgeable about taking care of adult cardiovascular surgery patients, but there wasn't anybody with real expertise on the pediatric side. I just saw that as an opportunity or a need in the unit, and so I just did a deep dive into learning everything I could about pediatric cardiology, kids who have heart problems, learning all about heart defects, because nurses need to know that information. And that really ended up being to my benefit. I had just kind of a unique set of knowledge and skills that I could offer to people that just really wasn't in the city, I don't think, at that time. It's also when I figured out how much I like to teach nurses. I just have a passion for making sure that the nurses know what they're doing at the bedside. I don't want a nurse who's just task-driven to give meds and take vital signs. To start out with as a new nurse, you're just looking at a body part or what is the problem immediately at hand, instead of looking at the whole person and what are all the needs that they have and what are the family dynamics and what's going to happen when they go home and what all do we need to do to make sure they're taken care of when they go home. I want my nurse to know what they're doing and why they're doing everything. If I can inspire a nurse to go into critical care. When I have students who contact me after they've graduated and they go, hey, I just wanted you to know that I went to work in a cardiovascular unit or a critical care unit, it may be peds or adult, wherever. And even, as a faculty person, when you have a student even come up to you after class and say, thank you so much for that explanation. That really makes more sense to me now. Those smaller things, I think, are just meaningful acknowledgement that I'm doing what I want to do. I have, trained hundreds of nurses that are at the bedside or went on to have an advanced degree. And even if, as a faculty member, the numbers are in the thousands that I have been able to teach. And some of those nurses have gone on and they're now teaching other nurses. So I think, that's very meaningful to me that I've been able to have that impact, just providing good bedside nurses.